Okay, today I'm going to discuss to you the listening subtest. So here is our guide for listening subtest. So the OET listening subtest can be tricky for the candidates. Why is that? You will hear different accent and the speed is much faster. So there will be 42 questions to answer and it is divided into 3 parts. The content of the test is generic in nature, which is suitable for all healthcare professionals. So it will be just the same for all the healthcare professionals who will be taking the test on that day. All right. So these are the frequently asked questions for OET listening. Some of the students or some of the candidates ask how many parts will there be. So as you know that there are 3 parts in the OET listening. It has part A, part B, part C. Part A, it has 24 questions. Part B has 6 questions. And part C has 12 questions. Okay. So the total length of the audio, it will last for 40 minutes. So that includes the pauses, which is the time given to you to record the answers based on recordings. All right. And next question is, how many times recording will be played? Remember, the OET listening will be played once only. So you have to focus, concentrate as soon as the recording starts. So do not get distracted by anyone or anything. So be prepared to grasp well and answer the questions. Another question is, do I have to write the answer while listening? Yes. The OET test, or the listening test, is to assess your writing skills at the same time your listening skills. So this should work together. You need to practice to write while listening. Okay, so it is recommended that you shall listen and write down the answers simultaneously. If you wait to record the answers, then you will miss out on answering the questions properly. Anyway, you will be given few seconds to read the question before the recording starts. So what about keywords in the question? Will I hear the same words in the recordings as given in the question? Actually, you will not be hearing the same words, okay? So most of the speaker would not use the same words from the question, so you have to work out with your synonyms or with you have to practice paraphrasing some words. Okay, so that's also the skills being assessed from you. So 9 times out of 10, you will not hear the same words which your questions are made up of. You will have to be smart enough to look for the words which can be much more similar to words used in the question. Okay, so remember those. Let's start in part A. Part A has 2 different consultation extracts, and in each extract, you will be answering 12 questions. So we have here example, extract 1, question 1 to 12. So you have to listen carefully and read at the same time the instruction given above. So like you hear an obstetrician talking to a patient called Melissa Gordon. This is one of our mock tests. This is our mock test 3. So I'm using this for our sample. All right. So you will be given 30 seconds to look at the notes. Okay, so you quickly read question 1 to 12. And then you have to take note the word before the gap. Okay, It's because you have to apply the content technique or content prediction technique and the structure prediction technique. So when we say content, that means you have to guess or predict what do you think would be the possible answer. Now, when we say, can you please take down notes on this? When we say prediction technique, that means, structure prediction technique, that means you have to check the grammatical structure of the sentence. So, for example, we have here work as a. So that means you will be supplying an answer that begins with a consonant sound or it has a consonant or begins with a consonant letter. And that is also an indication that you only have to write in a singular form. So that is what we call structure prediction technique. So when we say content technique, for instance, okay, let's say family history of. So most likely that would be asking about the name of diseases. So for example, family of diabetes or hypertension. So most likely you will be guessing or wait for the answer. And most likely, please take note as well that most of the answer are supplied by the patient. So you have to listen carefully to the patient. So based on our example here, you have to listen to Melissa Gordon. So the test will be made up of consultation extract in part A, and it will assess how good you are at identifying or analyzing specific information during consultation. So there are two consultations in part A, so which is the health professional to patient, and will there be, and you will have the complete notes for the health professional. So the health professional needs to know this information. And once again, the answers are supplied by the patient. So listen and concentrate on what the patient says. So please remember the healthcare professional can be any one of the 12 healthcare professionals. So in this case, we have here the obstetrician. So not only focusing on nursing or listening and reading, that is for intended for the 12 different healthcare professionals. Okay, now during this part, take a 30-second pause before each dialogue to go through. So as again, you will be given 30 seconds. Once again, you will be given 30 seconds to read the question 1 to 12. So if you go to the second consultation abstract, you will be also given another 30 seconds to read the question. So use structure and content prediction. So this is what I said a while ago. You have to work out the structure of the sentence, work out and read your answer, read the sentence together with your answer, and then check if it is grammatically correct. So that is very important. Now, content technique is to predict what do you think will be the answer to that particular question. So once again, the structure technique involves grammar and helps in predicting the type of word that could fill the gap. And content prediction is about the meaning of the words before and after the gap that would indicate the possible field. So, for example, it says suffers from. That means it talks about disease or illness should follow up in the sentence. So most likely, you will be supplying a name of a particular disease or a particular illness in that particular question. Now, we have here second consultation extract that is from question 13 to 24. All right. So we have another patient here. Okay. So we have here another patient. His name is Mike Royce. transferring from another practice. So just listen the conversation. So you will hear a GP talking to patient hypervoice. Doctor, follow the notes closely as the order of the answers will be read in the same order as the questions, and notes will be more organized as sections with subheadings and headings. Some sections like medical history, and then more subheadings like under medical surgery, history rather, it will be surgical history and the medication. So in this case, we have description of initial symptoms, impact on daily life, initial treatment, and developments in condition. So those are the headings. Now we have here, try to focus more on how the speaker uses intonation, okay? Where are the pauses and signposting? Because these will help you to identify if the subject of talk has changed. So for example, the doctor will take a pause before asking about previous surgeries. Okay, so and then he would or she would say, and now I'm going to ask you about your family history. Is there any of your family member who have similar disease as what you have? Or any family members who had history of cancer? So you will know that you will be proceeding to the next section. So do not bother about spelling in listening because it is not part of the marks criteria in part A, and more emphasis should be made towards making the meaning clear. All right? Okay, so you're lucky. Next, now we're going to get familiar with the different question types in listening part B. But here, by the way, I want you to take down notes that in part A, you will be encountering 3 different types of questions. First, from question 1 to 7 is what we call matching time, because the first questions you're going to, oh, sorry for reading. This is all fill in the blanks, okay, or what we call note completion. So part A is all more on note completion. All right. So we have here sample in part B. Okay, part B, you will hear 6 different extracts. Therefore, you will be listening to 6 different speakers. Oh, sorry, 12 different speakers. So in each extract, you will hear 2 different people or 2 person talking. So there are 6 extracts, so most likely you will be listening to 12 different people or different speakers. So we have here example on our part B. This is the technique when you are answering part B. So you read the instruction, okay, or read it together with the audio while the audio playing. And the audio in this part will tell you which number that you're going to read or answer. So now question 25. You hear a dietitian talking to a patient. So you can hear a dietitian and a patient talking here. So what is she doing? So most likely the dietitian would give instruction maybe to the patient or giving lecture. So we have here choices, A to C, correcting the patient's misconception about obesity, B, describing the link between obesity and other diseases, and C, stressing the need for a positive strategy aimed at weight loss. Okay, now you have to remember who's the one talking. So in this case, it most likely is the dietitian. So the dietitian is talking to the patient, and what do you think is she doing? Okay, so if you think that she's giving a lecture or correcting or describing or stressing, then pick your answer. All right. All of this will be mentioned by the speaker. Okay, but you have to stay focused and concentrate on the recording. All right. Okay, now we have here question 26. You hear members of hospital committee discussing problems in x-ray. So the focus of this question is talking about the problems in the X-ray. So the problems are due to delay in. So what do you think is the cost of the delay of this? Is it buying a replacement machine, or is it getting approval for a repairs to a machine and identifying a problem with particular machine? By the way, in part B, you will be given 15 seconds to read the question. Okay? 15 seconds for each extra. So you quickly read the question and pick the keywords that would give you idea what is the purpose of that particular extract or the focus of that particular extract. And then the recording would play for 45 seconds. All right, now let's move on. So while you are, by the way, sorry, before I move on, while you are listening to the extract, you don't need to keep looking here. Just stay focused. And then once the recording stops, then you decide which answer is best fit to that particular extract. Okay, now part B has 40 to 60-second long 6 recordings of medical professional, and there will be multiple choice questions for each conversation and pre-probable answer. Similar to part A, use the process before every recording. So that is 15 seconds. And concentrate on identifying the keywords. For example, when you hear which technique does the surgeon recommend? So that the focus on the language of recommendation. So try to recognize the synonyms of the keyword. And please, again, remember this, that the recording will not be using the same words that is being used in the question. So you have to work out the synonyms. What's the synonyms of that particular keyword? All right. Now, also in part B, it's all about techniques that will allow succeeding here. So a few questions will test your understanding of the overall conversation and its purpose. Some questions will ask for specific pieces of information. However, the question you will not hear, as I've said a while ago, not hear the exact words of the conversation, the question or answer. So be conscious of all the possible synonyms and paraphrases. So the trick is, again, the conversation will hold parts of all the 3 answers. So once again, as I've said, the speaker will mention all of that, but listen carefully and identify the best fit. So do not fall for recognizing words. So most likely that is not the answer. All right. So for example, here 28, you hear a trainee nurse asking his senior colleague about the use of anti-embolism socks for patient. Now, the patient isn't wearing the socks because, so you listen carefully to the trainee nurse, maybe she will explain why the patient is not wearing the socks. First, or letter A, she's suffering from atrial disease in her legs. B, there is sensory loss in her legs. C, her legs are too swollen. So quickly read that, and then once the recording starts, you don't need to keep looking on the question, or once the recording start, stop reading the choices. You only get confused. Concentrate and focus on the conversation, and then you decide for the answer after that. Okay, now these are the 4 important tips on how to ace IELTS. Oh, no, sorry, IELTS OET listening. Okay, part C, you will hear 2 consultation, or not consultation, two different presentation and interview. Okay, and in each interview, the speaker would discuss a particular disease. Okay, for example, we have here, you hear, or a situation or a problem. You hear physiotherapist called Chris Maloney giving a presentation in which he described treating high jumper with knee injury. Okay, so in this part, The recording will not tell you which number you are or which number that you're going to answer. So you have to concentrate what's the focus of the conversation. So you will be given 90 seconds in part A for each interview, 90 seconds. So you're going to read question 31 to 42. And after that, another 90 seconds for you to read, 31 to 36. That's 90 seconds. And then after which, you will be given another 90 seconds to read question 37 to 42. So here, you have to know and understand what is the topic. Okay, the topic is talking about the physiotherapist will be describing a treatment given to a high jumper who had a knee injury. So number 31, when Chris first met, okay, the keyword here, first met the patient, he found out that, what do you think he found out? So he would say, okay, on the first meeting, I blah, blah, blah. Okay, or in the initial meeting. So then once again, you have to highlight the keywords and try to think what do you think would be the possible synonyms that the speaker would use. Okay, so the final part is part C, which is 15 minutes long. So 2 recordings of presentation or interview of healthcare professional will be played, and there will be 12 questions and 3 possible options. Make sure of the pause between each, make use of the pauses between each recording before you start listening. So you will be given a 90-minute, that's not 90 minutes, sorry. That is 90 seconds. Will be given to take a look at the question in each section. You need to concentrate on the connection between the effect and cause and try to understand comparison, emphasis, and opinions. Synonyms and paraphrasing are still essential in this part. Facts and figures, because sometimes in part A, you will be, the speaker would talk about the statistics. Okay, for example, it says 6 out of 10, and then or 90% of the population experienced or had yellow fever. So that talks about figures. Okay. And there will be no pauses once the dialogue start and focus on parts where the speaker is moving towards a new topic. So pay heed to how the person is speaking and the words like, and now, well, so that means that speaker would move to the next conversation or to another topic or new subject. So in the case of an interview, the question will indicate the topic of discussion. So for example, here on our second presentation or on the second presentation or interview, you will hear a clinical psychiatrist called Dr. Anthony Gibbons giving a presentation about the value, sorry, I cannot clearly read, the value of individual patient experiences and stories in medicine. So question number 37, what impressed, okay, the keyword impressed about the case study that was sent to him. Number 38, Dr. Gibbons has noticed that people who read his books, okay, right, so read what is the focus or what is the topic of that particular interview or presentation. So during part B and C, please use pencil because you will be filling the circle. So you get an extra pencil along or just in case the computer, and please shape completely, okay, by filling the circles completely also. Okay, the computer will check your part B and C answers, so clearly mark the answers by filling the circles completely and not partially. Now, you can use pencil in part A, right? But if you make mistake, just cross out the errors with one line. Now, in part B and C, I recommend you to use pencil because just in case you want to change your answer, you're going to erase that. Please erase completely because if you say both of the number, for instance, like this, number, sorry, uh, the letter, and then you want to change your answer. And so you're going to do that. And then you say letter A. So the computer will get confused. So for you to get a good mark, erase it neatly. Okay. So an answer is an answer, be it or wrong. Now, in the listening, OET listening, if you want to improve your score, these are the things that you have to remember. Okay, first, practice listening to a variety of accent. Okay, in order to improve or help you to improve your ability to pick out the specific words you need, you must be able to comfortably follow how these words will be pronounced and articulated in a different accent. Okay, so let's say in English, they would say water heater, American English rather, water heater. But then British, they would say, or the Brits, they would say water heater. Do you have water heater? So it's different. But in American, they will say, do you have water heater? Do you have water heater here? All right. So you have to practice listening to a variety of accent. Okay. Because mostly in American accent, or generally in an English native speaker, they also always link the words. So number two, remember that words do not always have boundaries. So in spoken English, the word that ends with consonant and then followed by a word that begins with a vowel sound, they link it. So if you are not familiar with spoken English, it seems if you only have one word that has spoken, it would sound like one word only actually. So even if it's two or even more may have been said. So for example, the old age. Okay. What a good idea. Actually, that says, what a good idea. All right. So it's like that. You have to get used to this. That's what we call the blending. All right. The blending of the word. Normally, usually, American, British, they connect the word. All right. They just pronounce it as one. All right. Next, make prediction. So this is what I have mentioned a while ago. When you look at the set of notes in front of you, you will see that you have a lot of information which is already completed. The specific word or phrase which you need to complete will be linked to the information which has been provided. So once again, how would you do that? We have the structure and the content prediction. All right. And so, for example, paid located in, so that is content prediction. And then wait for the patient to say which part, so that talks about the body parts, which part of his body or her body is aching. So if he would say, feel so uncomfortable, especially at night on my right arm. So you write your answer right arm. Okay. All right. Next, we have next, use the notes as a guide. Okay. So as I've said a while ago, the heading would help you or use as your guide. Use the heading as your guide. That would help you to keep on track on the listening. All right. Linked to the above point, the notes aren't there just to help you in terms of making logical prediction. They are also there to guide you through the dialogue so that you don't get lost as you listen. So use notes for this purpose. All right. Um, so here, number 5, don't try to understand every word. You don't have to. Once again, just quickly read the question and then work out with the synonyms. Um, check the word before the gap for part A, and then for part B, highlight the keyword. What is the purpose of that particular extract? And then in part C, you have to listen carefully. What is the speaker trying to say? Is it talking about the first time that he or she met the patient? And then what has he have discovered?
Okay. So that's it. That's all for our listening skills enhancement. If do you have any question, please message me if there's any clarification. For those who can attend tomorrow for the classroom at 2 to 5 p.m., please come because I'm going to give you the exercises here in our classroom. And for those who cannot, you just answer it through our Google Classroom. Okay, so